Imagine living with emotions that feel like they returned up to maximum volume. Not just happiness or sadness, but intense connection, intense fear of losing people, intense reactions, and a deep sensitivity to small changes in relationships. At the same time, the world around you often misunderstands you, labels you, or calls you too much. Many people with borderline personality disorder face not only emotional pain, but also stigma and misconceptions. In this video, we are going to talk about what borderline personality disorder truly is, what the real signs look like, what myths need to be cleared, and how recovery and healing are genuinely possible. Borderline personality disorder is not a character flaw and not weakness. It is a condition that affects how emotions are experienced, how identity is shaped, and how relationships feel. People with BPD are not broken. They are often deeply sensitive, deeply caring, and capable of meaningful growth with the right support and skills. The goal of this video is simple: reduce stigma, increase understanding, and share real hope. Borderline personality disorder, or BPD, is a mental health condition linked to emotional regulation and relationships. People with BPD often feel emotions more intensely and more rapidly than others, and those emotions can take longer to settle. This difference in emotional processing can make daily life feel like an emotional roller coaster, even when the outside situation looks small to others. The term personality disorder in psychology does not mean someone has a bad personality. It simply describes long-term patterns of thinking and feeling that cause distress or difficulty. It does not define a person's value or potential. BPD exists on a spectrum. Some people are expressive and reactive. Others are quiet and inwardly distressed. Some struggle mostly in relationships, others with identity or emotions. There is no single type of BPD, which is why stereotypes are so harmful. BPD is not a choice, not attention-seeking, not laziness, and not a life sentence. It is a condition that can improve significantly with proper treatment and support. One of the core features of BPD is emotional sensitivity. The emotional volume is turned up, and the emotional switch moves quickly. Situations that others brush off may feel deeply painful or threatening. A small shift in someone's tone, a delayed reply, or a small misunderstanding can feel enormous. This experience is real and powerful, not imagined or exaggerated. Daily life may feel like walking through the world without emotional armor. Joy feels intense, connection feels powerful, fear feels urgent, and sadness can feel overwhelming. This heightened emotional sensitivity is challenging, but it is also connected to empathy, creativity, and deep emotional understanding. Signs of borderline personality disorder can show up in many ways. One common experience is an intense fear of abandonment. Small changes, a canceled plan, a late message, or even silence can trigger strong fear of losing connection. This fear can lead to feeling panicked or desperate to fix the situation quickly. Relationships may also feel unstable internally. A person might feel very close and connected one moment, and suddenly feel rejected or misunderstood the next. These shifts usually come from emotional sensitivity, not from lack of love. Strong emotions are another experience. Feelings rise rapidly and can feel overwhelming. What others see as an overreaction is often the nervous system responding more intensely than average. Identity may also feel uncertain. A person might ask, "Who am I really?" Goals, values, or self-image may seem to change over time. leading to confusion about one's sense of self. Impulsivity can happen when emotions are extremely intense and someone is trying to get relief or escape discomfort quickly. Some people describe chronic emptiness, a sense of emotional numbness, or lack of meaning. This is a symptom of the condition, not laziness. Sensitivity to rejection or criticism can also be very strong. Even small comments may feel deeply painful or personal. Everyone's experience is different. Only trained professionals can diagnose BPD. Self-diagnosis or casual labeling is not helpful and can be harmful. There are many myths about borderline personality disorder that create stigma and shame. Myth 1. People with BPD are manipulative. In reality, behaviors labeled as manipulation are often attempts to reduce fear, get reassurance, or reconnect when emotions feel overwhelming. They usually come from pain, not from a desire to control others. Myth 2. BPD cannot be treated. The truth is that BPD is highly treatable, and many people experience major improvement with therapy and support. Myth 3. People with BPD are dangerous. Most people with BPD struggle more internally than externally. They deserve compassion, not fear. Myth 4. BPD is just drama. In truth, BPD is connected to real psychological and biological processes, especially involving emotional regulation. Myth 5. People with BPD can never have stable relationships. Many individuals with BPD build healthy, lasting relationships once they learn emotional regulation and communication skills. There is no single cause of borderline personality disorder. It usually develops from a combination of biological and environmental factors. Some people are born with a more sensitive temperament or nervous system. Others grow up in environments where emotions were ignored, dismissed, or misunderstood. Stressful experiences, instability, or chronic invalidation may also contribute. This is not about blaming parents, families, or individuals. Human development is complex. What matters most is not who is at fault, but how healing and support can happen now. People with BPD also carry powerful strengths that are rarely discussed. Many are highly empathetic and emotionally aware. They can sense emotional shifts in others quickly and care deeply about people they love. Many are creative, expressive, intuitive, passionate, and honest about their emotions. The same sensitivity that creates pain can also fuel art, writing, music, advocacy, leadership, and deep relationships. Sensitivity is not weakness. It is energy that becomes powerful when supported with healthy skills and boundaries. Recovery from borderline personality disorder is real and achievable. Dialectical behavior therapy, or DBT, is one of the most effective approaches. It teaches practical skills for emotional regulation, distress tolerance, mindfulness, and communication. Mentalization-based therapy helps people understand their own thoughts and feelings and better interpret the emotions and intentions of others. Schema therapy works with deep belief patterns formed earlier in life and helps reshape them into healthier ways of thinking. Trauma-informed therapy focuses on safety, nervous system regulation, and restoring a sense of stability in the body and mind. Recovery usually includes building routines, learning emotional skills, developing self-compassion, practicing boundaries, and surrounding oneself with supportive people. Progress is not perfectly straight. There are ups and downs, and that is normal. Forward movement, not perfection, is the goal. Families and friends can be powerful allies in recovery. Helpful support includes listening calmly, validating emotions, avoiding harsh criticism, and encouraging therapy gently rather than forcefully. Setting clear, compassionate boundaries helps everyone feel safer. Celebrating small progress matters. Simple understanding can be healing. Sometimes listening is more powerful than giving long speeches or advice. A diagnosis does not define a person's future. People with borderline personality disorder study, work, build careers, create art, love deeply, raise families, and live meaningful lives. Many say that after treatment, they still feel deeply, but they know how to manage emotions in healthier ways. The goal is not to erase sensitivity. The goal is to live well with it. If this video helped you understand borderline personality disorder more clearly, share it so others can learn without stigma. If you recognize some of these experiences in yourself or someone close to you, remember that you are not alone and you are not too much. You are a human being with real emotions that matter, and recovery is possible. If you enjoy content about psychology, emotional health, relationships, and healing, subscribe to the channel, turn on notifications, and stay connected for future videos. Your support helps this message reach more people who may need it. Thank you for watching.